and welcome to Fireside Chats with MCL, that's me. Today we are going to take a look at the disease of leukemia. We're going to get the chance to talk to Benedictine college students and see what they know about leukemia, as well as talk to a specialist who has worked with leukemia patients for over 15 years. Let's go see what Benedictine college students know about leukemia.
Alright, what is leukemia?
I know it's a type of cancer that attacks blood.
Good.
A blood cancer.
Yeah!
It's a blood cancer.
I know it's a type of cancer.
Okay, that's good.
I gotta be honest, the only reason I probably know anything about it is because of A Walk to Remember.
I think it's a type of cancer or something to do with cancer. I'm not really sure exactly.
Do you know how many people in the U.S. are affected by leukemia each year? Just take a guess.
Maybe like 1% of the population. I would say 3% of the population.
I'm going to guess about 400,000.
2,000.
I'll give it random 2 million.
So, what do you think happens inside the body when someone has leukemia?
When someone has leukemia, I think what happens is I think it's their white blood cells start growing out of control, and then they kind of start attacking the body, and then it starts attacking all your systems, and things break down because of what happens to the white blood cells.
The cancer cells attack the regular cells and multiply, and then there's less number of regular cells and a higher number of cancer cells.
Maybe the white blood cells die.
To talk about the pathophysiology of leukemia, I have a nursing student here, Allie.
So with leukemia, stem cells in the bone marrow are mutated, and this prevents them from turning into normal blood cells. Instead, they're turned into leukemic cells. And then these leukemic cells multiply out of control and replace all the normal blood cells. And then this decreases the amount of platelets and red blood cells and white blood cells in the blood. And then once the leukemic cells enter the bloodstream, they filter through all the organs and tissues and can cause damage.
Okay, what makes a person more likely to have leukemia?
Genetics.
I have no idea.
Can I phone a friend for this one?
Yeah, you
Great.
can phone a friend.
John!
Hello.
Hi, what makes a person more likely to have leukemia?
1 second, let me think. I would say maybe environmental problems, if there was there was a plant nearby that was spilling waste into the river and you're drinking bad water your whole life. Maybe you stuck your head in a microwave and there was radiation hitting you, and that's how you got it. Yeah, those are a couple examples of how you could probably get it.
Great, thanks, Sean.
No problem, daughter. I'll see you later.
I would guess genetics and maybe environmental issues, maybe.
Person is more likely to have leukemia. There's a number of different factors that would go into it. Early onset leukemia or leukemia associated with children is usually a genetic disorder. So they would be inheriting mutations from their parents, whereas in older individuals it's more of an accumulation of mutations over time.
To tell us about some risk factors of leukemia, I have a nursing student here with me, Taylor.
Thanks for having me, Maria. Alright, so the first risk factor, as with most diseases, is smoking. And then you have chemical exposure to things like Agent Orange or gasoline in general. Then you also have secondhand radiation from your chemo or from radiation itself. And you can also get it from being exposed to radiation from an atomic bomb, like in Hiroshima and Nagasaki. It also comes along with rare congenital diseases like Down syndrome. Finally, if you have a different blood disorder, and if you're a male and you're over the age of 50, you are more prone to be diagnosed with leukemia. Do you know some of the symptoms of leukemia?
Joint pain, fatigue, and loss of appetite.
Wow, I'm really impressed.
I know it makes you tired, I think. Emaciates you a little bit.
Leukemia. So, leukemia as a cancer of blood cells, especially white blood cells, I would imagine that a lot of the symptoms of leukemia would be things like becoming sick more frequently, in addition to having a lot of normal like fatigue and things like that.
Now, to tell us about some signs and symptoms of leukemia, I have Megan.
Some common signs and symptoms of leukemia include fever and chills, fatigue, persistent weakness, weight loss without trying, swollen lymph nodes, an enlarged spleen or liver, and finally, you're easily bruised or easily bleed.
How do you think leukemia affects a patient and their family?
Well, one can only imagine that it has a lot of effect on the patient and their family. The fact that they're going through such a hard time, somebody struggling with cancer, obviously a big deal. I think that it requires a lot of prayers and a lot of thoughts to go out because it is something that has been proven very hard to fight in today's society.
I'm guessing it's just really hard because like it is something that usually you're diagnosed earlier with, right? And so to actually have to kind of live with that your whole life and not recover, really, that'd be really hard on the family to like have to support both the family members and the person who's sick through the process.
A family, it would definitely affect the family, just seeing their child suffer through it. And obviously the medical expenses would also be a lot.
It's tough anytime you know a loved one or someone you know is going through cancer treatment, so it just takes a mental toll on the family.
To talk about the effects of leukemia on the patient and their family, I have another nursing student, Becky.
So, leukemia affects patients and their families in many ways. There's emotional effects wherein leukemia can cause anger, sadness, shock, fear, anxiety, or other such feelings. There's also changes on the role of the patient and their families as the patient becomes more in the role of the one receiving care, whereas their family maybe take on the role of giving care. There are also changes in this relationships wherein they may withdraw socially from others. There are also spiritual effects where patients may feel punished for past actions, or it could be an opportunity for them to grow in their faith as they feel that they are able to offer it up for the betterment of others.
Do you know anyone with leukemia by chance?
Yeah, we had a family friend back home. This little kid was diagnosed with leukemia when he was 4 years old. He underwent lots of chemotherapy, radiation treatments until he was in 8th grade, I want to say. So they dealt with this for 4 years, and there was a while in the middle where he really wasn't doing well. They thought that things were, not going to turn out well in the end. But now he's making full recovery and plays sports. He plays basketball on the high school varsity team and has, a great life, great time. But for a while it definitely it's a scary disease, and it really impacts the family and the patient also. It's a really hard thing for a family to go through.
Hi, I'm Rebecca Houghton, and I work on oncology. I've been a nurse up there for 16 years, and the junior students asked me to answer some questions for you guys. So, how many years experience with leukemia patients? It's been 16 years. How does chemotherapy or other leukemia treatments affect the patient and family? It starts from day one of what, as the patient, we have to educate them. What do they expect we're going to give them? What's the side effects of the treatment? So the education part, I think, takes the longest to make sure that they're aware of everything they're going to get. Some chemotherapies are given by mouth. Most of what we give inpatient are IV. And we go over the main side effects of the chemotherapies that we're going to give them, usually nausea, vomiting, diarrhea, could be constipation. Some chemotherapies have hair loss, some don't. And big thing with chemotherapy, how it affects the patient, is fatigue. So they're going to be so tired throughout this treatment, sometimes not wanting to eat, not wanting to get up and walk. What is wrong with me? And then the psychosocial part is dealing with depression. I can't perform my ADLs like I normally could. Am I going to file workman's comp because I can't go back to work? These are all factors we have to take into when we're taking care of the patient. And as a chemotherapy nurse dealing with these type of patients, it can be mentally exhausting because you have to give your whole heart to these patients. You have to be there mentally and physically for them. So when they're down, try to cheer them up, trying to think of outside the box, what can we do for them? It's hard when you've gone through chemotherapy, you've been in remission, and then boom, you find out you have cancer again. And then think, am I going to go through the whole thing of being sick every day, throwing up, diarrhea? How much can I take? So as a nurse, I have to be able to sit with them and have them ultimately make the decision, but support them as any way I can. And always make sure it's the patient that makes the decisions. It's not the doctors, it's not the nurses, it's the patient. Dealing with end of life when you're an oncology nurse, when you're dealing with the chemotherapy, also can be very hard because of, I gave you the example of I've given that 90-year-old whatever chemotherapy and they died the next day. As a nurse, I know the end result sometimes is not going to be the best, but to support them and getting the chaplain involved, getting other resources for them, because when you're dealing with end of life, as a normal person, as like you guys, you don't even think of like that stuff. What do I need? Am I going to be able to afford a casket? Funerals cost at least $5,000. Who has that kind of money? So just kind of dealing with all that, dealing with other disciplinaries, case manager, social worker, chaplain, kind of pulling it all together.